Vienna at the International AIDS Conference, human rights will be the main theme of the conference. We had to wait many years, we had to advocate very hard for it, but rights here, right now, is now the theme of the conference.
We've been working for a long time to spread the message that HIV is about human rights and that we need to incorporate rights in our response. And having a focus in Vienna that integrates the idea of rights into every session, whether it's a session about prevention, whether it's a session about treatment, whatever we're talking about, we need to look at a rights approach, a rights perspective to it, and incorporate that in.
Because it's going to be human rights, we're going to see many more community people in this conference. This is absolutely critical, to hear the voice of the community. When you have a theme that says rights is the theme of the conference, then everybody is more attuned to listen to that voice. And therefore, we would be there in large numbers just to make government, state, society listen to us and tell them that, we have to learn to respect and give dignity to everybody, and only then we can fight the epidemic. Otherwise, we can't fight this epidemic.
It's of course not the first time in this Vienna conference that people talk about human rights being at the center of the fight against HIV, but it has to be made real and it has to have money behind it. And that's the problem. Rights-based approaches are an easy thing for everyone to say. We have to talk about how and who and with what funds people are going to reduce punitive and repressive laws that stand in the way of HIV services. We have to talk about real attention to the status of women and the way that they are vulnerable to HIV. We have to talk about real attention to the rights of children.
Something that is very important about the conference is the focus on people who inject drugs and their needs, and looking at what is happening, for example, in Eastern Europe and Central Asia, where services, programs, commodities for this key population, they don't exist just because there is no political will, there is no interest in them, they just, put them in jail or, forget about them.
Many countries pass laws criminalizing HIV transmission. Many countries have laws that prohibit implementation of evidence-based drug treatment. These laws need to be a thing of the past.
One of the priorities of UNAIDS right now is to remove punitive laws, policies, practices, and stigma and discrimination, some of the issues raised in this document. But we need to be able to say the following countries have HIV-related travel restrictions, they have laws that are overly broad criminalizing transmission, they have laws that criminalize possession of small amounts of drugs and send drug users automatically to jail. We need to be able to come so that people focus on where the problems are. Don't talk about the issues in abstract. So if we can use the passion behind human rights that is often at these big conferences, but connect that passion to practical steps, then it'll be a real opportunity.
The most exciting, the most energizing about the meeting are the people coming to the conference for the first time. And sometimes it's people who are newly positive, who are newly activist, who have never seen the community of people coming to the conference, who've never seen 25,000 people who care passionately about HIV and want to make a difference. And to have, at that time, a discussion about human rights and HIV, and to have that discussion taking place and demonstrating to people the power that human rights can bring to the table. Because human rights is about accountability. And everyone there should be talking about how can we make sure that the institutions, the donors, the governments are being held accountable for the commitments that they've made about HIV, for the goals that they've adopted. That will make a change.
And hopefully it will make world leaders sit up and think in terms of, yes, this is why human rights are so important, and this is maybe why we should be committing a little more political will, a little more financing, a little more budget to making sure that human rights are respected and protected in the context of HIV.
A priority for AIDS 2010 in Vienna is to help people realize that by strengthening HIV programs, we are strengthening health systems. And that human rights responses to HIV are not about taking our attention off other health priorities. They're about realizing that a human rights response to health generally is needed. So we hope that one legacy of AIDS 2010 will be that AIDS continues to remain paramount on the global health agenda, integrated into other health priorities, of course, but not swept aside as an issue that is no longer of global importance.
The human rights theme provides the opportunity for us to say, it's more than just about the science, it's about the people, and it's the people that are at the center of this discussion. I just really call out to the young people that are involved in this response to take Vienna as a cue to think the next generation of the HIV response must put human rights at the center. The human rights of children and young people, the human rights of the most affected groups, the human rights of everyone, and really call on this next generation to say, no more of marginalizing of our rights and other rights. Rights must be at the center, and we're not going to accept it any other way.
For further information on human rights, HIV/AIDS, and to endorse now more than ever the joint statement, visit www.hivhumanrightsnow.org.